Hey guys, how are you? Today I'm going to talk about very important subject and many ophthalmic practitioners don't pay attention to that. Simply when you say that this pentacam is abnormal, normal or whatever, on what grounds? Based on what you say that? Simply based on established reference. To evaluate the corneal surface correctly, you have to compare it to a reference. Or you can say an ideal reference or an ideal surface. So from now on, we will name the corneal surface as the surface under test and the reference as the ideal surface. So we have two main references, or you can say two main ideal surfaces or references, best fit sphere and best fit toric ellipsoid. So when should we use this or this? That's the subject of the video. Simply, if the corneal astigmatism is not significant, less than 2.5 diopters astigmatism, use best fit sphere as a reference. Because in this scenario or in this case, this corneal surface is considered spherical. So it's pretty fine to use best fit sphere as a reference. But if the corneal astigmatism is significant or greater than 2.5 diopters, use best fit toric ellipsoid as a reference. Why that? Because in this scenario or in this case, this cornea is not considered as a spherical surface. It's considered as an ellipsoid shape. As you know, the ellipsoid shape has two different meridians. One of them is flat and the other one is steep. Quite the same of the cornea with high astigmatism. So this reference will tolerate, evaluate, or interpret this cornea correctly, because both of them, of course, the cornea and the reference, have two different meridians with different curvatures. So what if we use the wrong reference, for instance, a cornea with high astigmatism, and we use best fit sphere as a reference? Simply, best fit sphere tolerates only spherical corneas, so it will consider this cornea as abnormal. Because you are comparing two different things. You know, it's like when you compare the velocity of the train to the tallness of trees. Okay, this patient has about 5 diopters of corneal astigmatism, and the reference used is best fit sphere. And of course, it's not the right reference. But if you look carefully at the numbers of the back elevation, you'll find out it's about plus 29. So according to this cornea is abnormal or has a posterior corneal surface irregularities. But you know what? When we use the right or correct reference, the numbers immediately becomes accurate. And the cornea becomes, of course, normal, because now we're using the right reference. Also, there is something very important I want to say about the best fit toric ellipsoid. Because the best fit toric ellipsoid was found to hide the cone in certain patients with early keratoconus. However, it's crucial to avoid using the best fit toric ellipsoid in cases of posterior keratoconus or in the early stages of the condition, as well as not to use it to minimize the numbers of posterior elevation map, especially in corneas with low astigmatism. So for the corneas with low astigmatism, as we said before, you should use best fit sphere. As you noticed, I only focused on the back elevation map to keep the video short and simple. The back elevation map is crucial in Pentacam analysis because corneal irregularities or keratoconus originate from the back surface. And please don't forget that this video doesn't cover the whole story, of course. It's focused on a specific aspect. Finally, I hope you found the video informative and helpful. So feel free to share your thoughts in the comment below, and please don't forget to like the video if you enjoyed it. Bye for now.